Welcome to Executive Insights. My guest today is Charles Lewis, Vice President and Chief Technology Officer with TELUS Health. In this episode, we explore the progress with digital health adoption in Canada and what the industry needs to do to foster better collaboration and connection. The role of TELUS Health in driving innovation in the Canadian healthcare ecosystem. Charles also shares practical strategies for motivating a remote workforce, and he offers sage advice to his IT leadership peers as we continue to navigate through these challenging times. Hi, Charles. Thank you for joining me today.
Thanks very much, Nasheen. Given our recent interaction on some of our panels, I'm really looking forward to speaking with you.
Me as well. Charles, the pandemic has really heightened the importance of data and technology in delivering patient outcome. And the reality is our healthcare system has been traditionally siloed with inconsistent digital footprint. And really hinders a seamless access to information and timely delivery of care. In your opinion, how are we doing with digital health adoption in Canada today?
That's actually a really great question, Nasheen. I'm glad that you brought it up. So overall, and this is simply because I'm a forward-looking optimist. I think we are continuing to accelerate digital healthcare adoption in Canada. Frankly, it's an area that Canada and Canadians have lagged behind many other areas of the world in over the last 20 years. But over the recent number of years, we've seen an acceleration of digital health initiatives at a number of different levels, federal, provincial, and particularly through private and public partnerships with companies like TELUS Health and others, working with provincial and federal bodies, as well as main partners in the acute primary care and virtual care spaces. During the pandemic itself, of course, it's really put a spotlight on the need for acceleration, not just in overall digital healthcare, but particularly in areas like virtual care, in physician-patient interaction, as well as being able to provide patients with a more accurate, more consistent and ongoing view of their care plan and folding them into that journey. So overall, I think to summarize, I'm very optimistic about our continued acceleration of digital health within Canada. I think there are a number of areas that we need to continue to push, particularly as it relates to connectivity of various systems within the health continuum, from the acute care to the primary care to follow-ups for home health care and virtual care as well. Those are all areas specifically related to connecting systems and patient profiles together that we need to continue to move forward.
Yeah, I'm really encouraged by all the progress and your optimism. And as an industry, what do you think we should be doing to foster greater sharing of information and collaboration at a wider scale?
Again, a great question. I think it comes down to a couple of key paradigms. The first is there needs to be greater lockstep and collaboration between both public bodies and private bodies to continue to enable adoption of healthcare. And I referred to connectivity of systems and building a picture of a whole patient going forward. So a good example of that is, we all in the private industry need to continue to work together with our partners in public sector to be able to not only meet needs of individual patients as far as healthcare goes, but also look at things like demographic health and overall health outcomes that we can continue to assist our public partners with. That connectivity, that breaking down of silos between systems, between provinces, is incredibly important to come to a bit of a unified health strategy on how we can improve patient care and improve patient outcomes as we move forward in the future. The other key for me is being able to advance much more heavily into the patient physician interaction paradigm. We need to enable patients to be much more involved in their day-to-day healthcare activities, to be part of an input and feedback mechanism. Those patients need to be enabled with their health data. They need to be able to consent to use of their health data and help direct their own care and treatment plans in conjunction with their primary care physicians or allied health professionals. As we take into consideration the whole picture of a patient, which relates to diet as well as physical health, just as importantly, or even more importantly, mental health. As we continue to be able to connect and provide all of these different services to a patient in a way that the patient can consume that fits their needs and fits their lifestyle, I think it will really help advance digital health technology and adoption within the Canadian medical continuum. So those are two areas I feel that need to really be addressed so that we can continue not only to accelerate those types of initiatives, but also start to move forward on things like health data strategy.
Those are two really valuable perspectives. The collaboration between the healthcare industry stakeholders at large and improving the connectivity between physicians and the patients directly. So excellent points. And dealing with COVID-19 has amplified the need for accelerated innovation in healthcare. As the largest health IT company in Canada, what is the role of TELUS Health in driving innovation in the Canadian marketplace?
This is an incredibly exciting time to be a part of TELUS Health. And I don't just say that obviously from a personal perspective. It's always an exciting time to be part of TELUS Health. But TELUS Health has the ability to help partner with a variety of organizations and people to be able to improve patient care and patient outcomes. And we've seen that just accelerated and explode through the pandemic. The greatest role that a company like TELUS Health can play is really around connectivity and collaboration. We provide systems that operate in many different areas. We provide electronic medical health records for physicians and clinics, pharmacy management systems for our pharmacy base. We have home health monitoring initiatives. We have significant virtual care offerings with Babylon by TELUS Health, as well as the Akira platform that allow patients, individual consumer patients, to be able to connect with a physician when they may not have a primary care physician or need care after hours. Our ability to continue to work with insurance adjudication and participate in provincial initiatives to continue to improve patient health care really positions TELUS Health well overall to be able to contribute to both that acceleration and improved outcomes. So really it's around our ability to connect systems together, not just the systems that we in fact ourselves are primary stakeholders in, but all systems across the healthcare continuum. Over the last few years, we've made significant investments in the TELUS Health Exchange, which is a collaborative communication system that allows all of our endpoint systems to be able to connect with each other, obviously with appropriate consent and privacy controls in place. But it's not meant to simply be a proprietary closed ecosystem. It's meant to develop an open ecosystem from which companies that are not TELUS Health or people who don't even use TELUS Health software and products are able to connect into that ecosystem so that they can provide value to the overall patient outcomes. They can help us continue to smooth out the patient experience. They can continue to provide information to physicians, to pharmacies that will continue to accelerate different patient outcome initiatives. So overall, extremely exciting time to be a part of TELUS Health. To summarize very quickly, the strength in TELUS Health lies not only in our commitment to customer, not only in our commitment to patient and to patient care, and improving that patient care, but the ability to collaborate and connect across essentially a large-scale open ecosystem using many different partners.
Thank you. Certainly very exciting times indeed. And I'm so glad to hear that TELUS Health is at the forefront of driving innovation, collaboration, and adoption. As the demands for technology solutions have significantly increased since the pandemic, I would imagine the demands on your business and workforce have also scaled up. And you mentioned that we spoke together at a industry panel recently, and we discussed the topic of helping our employees in a remote working environment. And you've shared some really great ideas and practical strategies that you've implemented to help your organization weather through the challenges, find their voice, and foster a inclusive and collaborative culture. Could you share some insights with our CIO audience?
I'd be pleased to. TELUS Communications overall, because we are a technology company, was pretty well positioned when the pandemic hit to be able to address team member safety by moving a large portion of our team members into safer home environments. Instead of being congregated together in offices, and being able to remove some of the risk around daily commutes on public transportation, especially in the early days of the pandemic, when there was still a lot of ambiguity around information. Our drive, our immediate sole focus was to take care of team members while being able to continue to run our business for our customers and the patients that they serve. Um, so we didn't have much in the way of challenge moving to remote style workforce because we previously had that infrastructure in place. TELUS Communications and TELUS Health, as well as all TELUS companies, are quite progressive as far as work styling goes. So we had very flexible ability for work arrangements previously. What changed during the pandemic is that remote work styling became the norm as opposed to a choice, something that you may do once or twice a week, or in some cases 3 times a week, and then spending time in the office as well. This brought up new challenges for us in a couple of different areas, and those can best be categorized as different environmental concerns, workload, as well as interaction with peers and with teams and team leaders. Particularly as we moved people home, we found unconsciously that people do things like they consider their commute to be part of their workday. So all of a sudden, people were working longer. In many cases, I'm very fortunate in that I have a dedicated office space in my home, but many people don't have such dedicated office spaces. And so we found that some team members were working potentially in non-ergonomic environments where there may be other elements in the environment that didn't lead to a productive work environment. And then, of course, there was the lack of physical interaction that we typically see in an office setting. And you could start to see some people begin, in some ways, to isolate. One of the key things that TELUS was interested in was doing an employee engagement survey within a few months of the beginning of the pandemic so that we can get a read on how our team members were feeling. And we saw during those results concern raised about additional stress or workload, as well as some of the issues I mentioned about contact with other individuals. So we took a number of steps, and it differs by team. I can certainly speak to some of the steps we took within my team. So we began to switch our cadence as far as communications with our team members go. We began to communicate incredibly regularly as to what we were doing and why we were doing it, looking to keep people informed. In fact, at the outset, certainly within my team, got feedback that we may have over-rotated on that communication initially. Had a number of team members reach out and say, Charles, we really appreciate the steps you and the leadership team are taking, to be able to keep us informed, but we're getting a deluge of informational emails, regularly scheduled meetings that maybe the cadence could be dialed back a bit. We accelerated or made more frequent our overall management meetings, as well as leadership and all hands meetings, to be able to get in front of team members more in a visible sense through video, to allow us to have a little bit of that connection, but more importantly, to provide team members a forum in which they could ask questions of their leadership team on any subject. We did see voices that prior to the pandemic, at least in a physical office setting, were very active voices around the table. And we began to see some of those voices self-mute. The reasons are not always clear. It can be a factor of working in a different environment or that lack of contact. So we also began to take steps to engage team members where we saw those voices beginning to self-mute, to ensure that they understood they were still empowered and encouraged to provide feedback, to provide ideas, to be active participants. So a number of different initiatives that we've taken. TELUS itself also began to execute on some additional rewards and recognition programs, where senior leadership at our ELT level, with our CEO, started to they implemented a new values program that publicly recognized some of the many initiatives that were going on to serve customers, both on the telecommunications side as well as the health side. This was particularly important within TELUS Health, because unlike many businesses that in the pandemic had to close, a demand for a set of TELUS Health products and innovations actually rose exponentially throughout the pandemic. So all of a sudden, there was a lot more pressure on our teams to innovate and come up with new ways to enable our clients and our customers to interact with their patients and their own customers. So it was very key that we began to recognize those things.
Yeah, thank you, Charles. I really appreciate your candor and honesty in sharing those very practical advice and strategies. I'm sure many leaders and organizations out there can benefit from your insights. And as a senior executive with both CTO and CIO responsibilities, could you offer a word of advice for your peers as we continue to navigate through these challenging times?
Yeah, it's peculiar. The advice is different a little bit for CIO versus CTO, although they converge when it comes to team members. Important, of course, is ensuring that we continue to maintain and continue to improve the infrastructure that allows our teams to operate remotely, to continue to serve our customers and the patients that are beyond those customers. It's just as important to ensure that our system's reliability is at its maximum, at its height, and we are not making errors as far as change goes. And so most of our audience will be well familiar with change management processes, but particularly for me in TELUS Health, the systems that we run and provide services for our customers have seen a hugely increased demand during the pandemic. So that becomes a very important focus as well. On the CTO side, there is an expression, and I forget exactly how it goes, but along the lines of never let a good crisis go to waste. Within crisis, there is opportunity for us to serve our customers better, opportunities for us to think about new ways of doing things, opportunities for us to spur innovation that will continue to drive digital health adoption, change the game on how we look at the patient experience across the health IT continuum. So being able to identify and foster those opportunities are just as important as things like stability. And the advice it tends to come together when it comes to team members. At the end of the day, team members are what makes a company work. It is their dedication, their engagement, their drive, and their commitment to customers that allow a company to be successful in achieving their vision. And so it's incredibly important that we continue to take care of our team members. It's particularly important around ensuring that there's kind of constant ongoing communications, keeping team members up to speed. Most importantly, ensuring that team members understand the why of what we are doing within both this pandemic and in normal times, and giving them an opportunity to feedback on that why and help us form the vision going forward.
Fantastic advice, Charles. Thank you so much. And I really appreciate your time today. This has been an amazing and insightful conversation.
Thank you very much, Nasheen. I very much appreciate your time today, and it's been great speaking to you again.
You've been watching another episode of Executive Insights. Thank you for tuning in. If you like this video, check out other CIO-centric content on our YouTube channel. And don't forget to subscribe